Got an amazing interview for us today. 2025 lifestyle goal, facial plastic surgery. Today, I have Dr. Thomas J. Walker, double board certified. I love it. Double board certified. He's dedicated essentially his career to exclusively cosmetic and reconstructive procedures on the nose, face, and neck. One of the most sought after plastic surgeons, facial plastic surgeons in southeastern United States. Dr. Walker, thank you for joining us. How are you, sir?
I'm doing well. Thank you for having me. I
Good.
appreciate it.
Excellent. Well, let's just dive right into it. Dr. Walker, what is facial plastic surgery?
Well, as the name implies, it's a surgery of the face, only face and neck. So we are all head and neck surgeons by training, and then we dedicate our career solely to the face and the neck. So we don't do any body surgeries, no breast augmentation or tummy tucks. So it's a 5-year surgical training in head and neck surgery only in the face, and then after that we did a fellowship specifically for cosmetic and reconstructive surgeries in the face. So it's an overall 6-year training program with board certification at the end.
Excellent, excellent. Thank you. Now, and facial cosmetic surgery is not a one-size-fit-all. I can only imagine it's customized, correct?
Correct. It's customized to every single patient. Every patient is different, looks different, and even if they were, let's say, identical twins, they may have different goals and wishes. So just because you look the same doesn't mean you want the same. So it's very custom tailored to the wants and the needs.
Okay. And what type of anesthesia is generally used?
Anything. It depends on the procedure and on the patient. A lot of our procedures are done in the office under strict local anesthesia. A lot of things can be done in the office. It's more convenient to the patient, less downtime. So there would just be injection of lidocaine. Oftentimes we use laughing gas if the patient wants that to be a little bit more comfortable. We oftentimes give Valium. So a lot of eye surgeries we can do in the office, jawline contouring, liposuction is done under local anesthesia. But then there are procedures that require general anesthesia. A lot of facelifts are done under general anesthesia, nose jobs, rhinoplasties. Generally, the longer procedures require general anesthesia. Or if patients have more anxiety than what they want, then we can also go to the operating room and do it under general anesthesia.
Okay. And who's a good candidate?
Everyone who is healthy and who has realistic expectations. It sounds very, what's the word I'm looking for? Stereotypical, but a candidate is anyone who just wants to feel better and who has some insecurities. As long as they are healthy and have no reason not to proceed with something, they are considered a candidate. And the expectation part is, can we deliver what the patient is seeking, what they want? And so once these two things are fulfilled, healthy, no medical reason not to proceed, and us feeling comfortable, me feeling comfortable, I can exceed the expectations, hopefully, then we are good to go.
Excellent. And where and how is the procedure taking place?
So a lot of the procedures, so we have our office in Sandy Springs, and we have our own surgical center attached to the office. So the in-office procedures, we have in the office also some operating suites. So the local anesthesia procedures are done in our office. And the operating room is a state-of-the-art facility, triple AHC accredited, which is the highest standard you can meet. And that's in the same location. We work with board-certified anesthesiology physicians, doctors who are in the operating room the entire time to administer the anesthesia. I do not work with CRNAs, nurse practitioners, so we always have an anesthesiology physician available in our own surgical center.
Okay. And how long is the recovery time? And let me just ask a couple of questions along with that. Is how long will the swelling last? And will there be bruising?
That would be a 1-hour answer to a simple question. Generally speaking, if you talk about injectables, there is no downtime. If you talk about some sort of surgical procedure in the office versus outpatient surgery from the operating room, 1 week is considered to be the downtime. Now, what do we mean by that? A lot of patients can go back to work before then, certainly work from home if you work from home, depends on your level of activity, sweating, but generally speaking, most procedures have a 1 week downtime associated with them. Eyelid surgery, eyebrow surgery, and after a week, people are good to go again. Jawline contouring. There are a few surgeries that require possibly up to 2 weeks of downtime, such as a facelift. The other part of the question is, when are results visible? Again, it depends on the procedure. An eyebrow lift is instantaneous. A chin augmentation is instantaneous. A buccal fat removal takes a little bit longer to show. So it really depends on the procedure. What is the downtime, and when are you restaurant ready again? I do a lot of rhinoplasty, nose jobs.
Yeah.
The downtime is 1 week from that. It's a 2 to perhaps 3 week downtime, I tell patients, for their social life engagement again. People are ready for their own wedding photos, generally speaking, after 1 month up to 3 months.
Okay. And Dr. Walker, you can appreciate this. We're all looking for immediate gratification. How
Yes.
soon will I see noticeable changes?
Again, procedure driven. The one that takes the longest, let's put it this way, to see noticeable changes, I would say, is a facelift neck lift and very, very few rhinoplasties. With rhinoplasty, the skin thickness matters. Someone like me who has very thin skin, you have immediate results the moment the cast comes off after 1 week. If somebody has very, very thick skin of the nose, which is longer, more swelling, a lot of African American patients or Southeast Asian patients, that probably takes a month or so before you have meaningfully noticeable results. So a lot of this is driven based on skin thickness, the activity level involved. People who have to do more strenuous activities after surgery that tend to sweat more leads to prolonged swelling. But generally speaking, I would say 80–90% of the procedures have a very meaningful result after 1 week already.
Excellent. And what are the most popular non-surgical procedures? Oh no. Hello? Did I lose you? Did I lose you? You there?
Now, yeah, yes,
Okay,
we lost each other, but I can see you again and
no
hear
worries.
you.
What are the most popular non-surgical procedures?
Injectables by far. Botox, fillers, Dysport are the non-surgical ones that I think win the list. Now, it's also seasonally driven. Currently, it's a winter cold month. A lot of lasers, resurfacing, chemical peel. Liquid rhinoplasty is very, very popular. Injectables into the nose to treat the little hump, disguise imperfections, and then PRP injections are very popular. But we draw the patient's own blood and re-inject it into hair on the under eyes, which is basically fertilizing your own skin and body, utilizing your own blood, which has growth factors in it to give that little extra improvement.
Okay. Doctor, with respect to your profession, you're an artist. What actually led you to this on this career path? At what point in your life was there somebody who influenced you? How did you get into this career?
It started early in high school. I knew medicine was always for me, and I always was a very. I always like to be. I'm a perfectionist. I'm very OCD, very meticulous, fine skilled work.
Yes.
I'm more of a sushi chef than I am, cooking big meals for so the precision is what kind of guided me to it. And then I had this teenager, my interest. There was a father of a friend of mine who was an ENT. So I went to his office and I was just, I liked it. And from doing residency, we rotated to the various subspecialties. Facial plastic surgery, especially rhinoplasty, resonated with me. And that's how I became a facial plastic surgeon. So the decision for that was during my residency. And it's really a combination of artistry and structural engineering. And those things overlapping those circles with my OCDness and strive for perfection is why I became a facial plastic surgeon.
That's excellent. And I can really appreciate OCDs. I'm very OCD about a lot of things. Doctor, I think I'm a candidate. Here's my question, and we all want to know this. What's your, my encouragement is a consultation. I want to get my viewers, I want to get my readers up from the article to contact you, at least start the initial consultation, because I have expectations. They might not be realistic. I give me 20 years of my life back, doc, show it in my face. What's your consultation procedure and what's the cost involved behind that?
Right. So our consultations are actually technically free. We do charge a consultation fee, which is applied to any service you have with me. So if you come in for a consultation, let's say for a rhinoplasty, there's a $20 consultation fee that is collected up front. And if you decide against the rhinoplasty with our education session, counseling, me listening to your goals, then it gets applied to any service you have done with me. You could be using it for Botox, for another surgery. You may have come for an eyebrow contour procedure and you end up with a lip filler. You probably won't. But anyway, that's how it works. It's a 45-minute to 1 hour visit. You meet my team. You're going to meet my patient care coordinator. We are going to ask you some medical questions just to get some background, some context. And then we are going to sit down. I take a lot of time listening to your goals and then examining you. I'm not selling anything to patients. I'm not the kind of surgeon who walks around with business cards, hey, you should do X, Y, and Z. And then we talk about various options. Not everybody is ready for the knife.
Yeah.
And then there's others who want the knife. And there are oftentimes multiple different solutions, always minimally invasive, to the same underlying problem. Some people cannot afford any downtime. Others say, hey, now is my time to have downtime. And so that's the consultation process, that we always give a customized estimate and quote. We go over financing options at the same day. There are many, many options for financing. And all of that happens in the same visit. So in the same visit, we talk about your goals. My patient care coordinator, after we discuss the various options, sits down with you and go through all the logistics.
Excellent. Dr. Walker, this is the end of our interview. Let me encourage my viewers and readers. 2025 lifestyle goal, facial plastic surgery. Take the first step. Contact Dr. Walker. His website address is thomaswalkermd.com. I'll have his phone number at the bottom of the screen for this video, and then you will be featured in our upcoming publication for Georgia Business and Lifestyle, winter 2025. Dr. Walker, I am honored to have you on. Thank you so much for our time. Any closing statement, anything to tell my viewers?
Yeah, I would just say, look, come in, let's meet each other, and bring along a family member, a friend. We can always have a conversation. And I think it's very important. I at least want to educate patients to make a good decision. The one thing that I struggled with early in my career, oftentimes people belittle a certain patient's concerns, and we all have.
Oh no. Oh no, did we lose you again? Darn it.
I think that's perfectly fine with me. I'm not here to sell you anything. I'm here to make you feel better in your own skin. But anyway, thank you for your time as well and having me on.
Dr. Walker, real quick, if you would repeat what you just said in that closing statement, because we got hung up here. I don't know what happened.
I see. Okay, let me try that again. So in the consultation process, I encourage patients to bring a family member, a friend who's involved in your decisions. Let's talk about things. We all have some insecurities about ourselves. Some of us belittle them, but it should never be done. And no matter how pretty you are, there might be this little thing, and we discuss your options. And if you end up leaving doing nothing, it's perfectly fine with me. I consider myself to be an educator, and I want to have patients make educated decisions. Come in, see us, and looking forward to meeting you. And thanks for having me on. I really appreciate your time.
Dr. Walker, again, thank you, sir. All right, be well. Have a beautiful day.